A professional counselor in the Dallas area is growing in popularity for his treatment methods.
How do you talk to kids about terror? And with social media and television, it's everywhere, and it's unavoidable for kids.
Rusty Lozano is the founder of the Center for Biofeedback and Behavior Therapy. He's also been nationally recognized for his work with brain mapping.
He's created a gym to work out the mind. His office features an obstacle course.
Rusty Lozano is a licensed professional counselor, helping children with headaches, with anxiety, ADHD, and more.
Here's where Lozano comes in. He teaches kids how to think their pain away with something called biofeedback.
A North Texas therapist is treating patients in this unconventional way.
We have Rusty Lozano who's joining us today. He's a licensed professional counselor.
He put together an unusual treatment for teenagers who are struggling with mental issues, except he's taking this now a step further.
Rusty Lozano, a leading therapist and pediatric biofeedback therapist based in Texas at the Center for Biofeedback and Behavior Therapy. And Rusty, thanks for being with us tonight.
Rusty Lozano, a father of 4 and also a professional counselor in Texas, says it's all about being a credible resource to your children.
The Therapy Hour with Rusty Lozano, your dedicated resource for mental health news, views, and tips you can use. Brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas. And now, here's Rusty.
Welcome to the Therapy Hour. I'm your host, and it is a nice Sunday afternoon. Very hot outside. And the summer months keep going, and I know as the school year starts to approach us, how well, there's a lot of things that we need to get in order. Medications in order for children, treatments in order for children, and having the right kind of specialist for your child's, for whatever symptom you may have. And some of those disorders may be a little scary sometimes and can be a little perplexing, and it takes a very knowledgeable specialist, a neurologist. Today we're going to be talking about epilepsy and maybe some pediatric elements of epilepsy. Let me go into what our topic is, an overview of it, and then I'm going to introduce our guest. Epilepsy is a central nervous system disorder. It's a neurological disorder in which nerve cell activity in the brain becomes disrupted, causing seizures or periods of unusual behavior, sensations, and sometimes loss of consciousness. Seizure symptoms can vary widely. Some people with epilepsy simply stare blankly for a few seconds during a seizure, while others repeatedly twitch their arms and legs. One in 26 in the United States will develop seizure disorder. Nearly 10% of individuals may have a single unprovoked seizure. However, a single seizure doesn't mean that you have epilepsy. At least 2 unprovoked seizures are generally required for an epilepsy diagnosis. Even mild seizures may require treatment because they can be dangerous during activities such as driving or swimming. Treatment with medications or sometimes surgery can control seizures for about 80% of people with epilepsy. Some children with epilepsy may also outgrow their condition with age. This is according to the Mayo Clinic. I'd like to introduce our guest, Dr. Khourey, CK. CK, welcome to the show.
Well, thank you. Thank you for having me.
Yeah, thanks for being back. You know, you and I did a show last year, and we had discussed headaches, and you had a lot of great information to share with our audience.
Thank you.
Yeah, very knowledgeable. And one of these guests are really, I ended up taking notes because I learned a lot. CK is a child neurologist at Texas Neurology in Dallas. And CK, talk to us a little bit about your experience with epilepsy and basis for it.
You know, epilepsy is one of the more common disorders that we deal with in neurology, especially in child neurology. And I'm duly trained adult and child neurologist, but I focus mainly on child neurology, and we do see a lot of seizures in child neurology. The main thing is that it's very scary to the parents when they see their kid losing control of his or her body or her mind. And the unpredictability of seizures, I think, is the scariest part, because if it's a disorder where you know every morning at 8 a.m. he's going to have this, then you can prepare for it. But when you cannot know if the child could be in the swimming pool, the child could be with his friends, the child could be at school, and suddenly it happens, that is the scariest part.
That would be terrifying to me as a parent or even as an individual to see them become mobile and try to live a normal life. But then there's always the underlying fear and concern that what if something happens?
Correct. The good news is that we have a lot of treatments that are effective, so a lot of these kids can lead completely normal lives. Of course, there are the few who have severe epilepsy disorders where they continue having seizures, but for the greatest majority, they can go back to leading normal lives. And as you said earlier, some types of epilepsy can outgrow.
And why does that happen? How do you outgrow an epilepsy?
So, as you said, an epilepsy is a seizure disorder. That's what people recognize as. And a seizure is an abnormal firing in the brain. As the brain matures, our connections in the brain are constantly changing. Your brain at 20 is not your brain at 10, is not your brain at 50. So as your connections are rewired, sometimes you silence out that pathway that was causing the epilepsy. And that's why some of these pediatric epilepsies can be outgrown.
So interesting that the brain isn't actually developed, and so what we're looking at is maybe wiring or function that hasn't really had an opportunity to solidify. So there's still a lot of circuitry being developed, and
there's constantly circuitry being developed. From day to day, you learn new experiences.
So even as an elder, yes,
as everything at any time of life, right? When you stop relearning stuff, you're dead, basically.
So there was a time when there was a belief that the brain actually stopped. You had a very small amount of time to introduce language and new concepts to a child. Is that an antiquated idea?
No, it's not that. It's easier for a child to acquire this information, but you see adults learning new languages. So it can happen. It just takes them way more effort. Because the easiest way that I explain to my patients is think of the brain as a computer network, because it is a computer network.
Yeah.
And as a child, you have tons of networks in place because you don't know which one is the efficient network. And as you're growing, as you're maturing, you're trimming away the inefficient networks and maintaining just what works for you.
Mm-hmm.
So if you've already had that network going on for you for 40 years, and all of a sudden you're like, oh, let's teach you another network, but you've already trimmed away all these other networks, so they're not active anymore. So it's very hard to reconnect these networks and put them back at work. And that's why we say you cannot teach new tricks to old dogs.
Right.
That's exactly where this comes from.
Because those neural networks are no longer active.
Correct. So you can still relearn. It just takes you a whole lot more effort.
Mm-hmm. And so as we're looking at the concept of epilepsy, perhaps there's a misfire in the brain. Do they really know like what causes
epilepsy? Epilepsy is two types that we think of. We think of the ones that are genetic, so the way your brain is built, the way the channels in your brain function, that they lead to increased excitability. And then we think of the epilepsies that are due to some kind of lesion. Like if you have a stroke, that scar in the brain can lead to abnormal firing and lead to epilepsy.
So just for learning purposes, what is a lesion? Is that an injury of some sort?
Any kind of injury. Stroke, a prior infection, traumatic brain injury. So if you have any kind of trauma to the brain, any kind of scar in the brain, or a brain tumor, or infection, anything that disrupts the normal brain function, that's what we call a lesion.
Mm-hmm.
And that can work as a focus for causing seizures. So it's disrupting the connection.
So really anybody at any time can develop seizure activity.
If you have a kind of brain damage, yes. And the other type is the genetic type. And then, of course, there are those that we don't know. So we divide epilepsies into three kinds. The symptomatic, so it's a symptom of some kind of injury.
Mm-hmm.
The genetic, and then the unknown in between. The unknown, it keeps on shrinking because we keep on identifying better ways of being able to know the genetics of stuff and see lesions that in the past we couldn't see. But there's always something beyond the limits of medicine that we don't know how to classify, so we leave them in the unknown group.
So is it ever possible, and I'm sure this is more of a medical, very big medical question, but is there a way to have surgery to remove some of these lesions to actually deactivate?
Yeah, and we do that a whole lot, actually. So when people cannot be controlled with medication and they keep on having breakthrough seizures, then we go looking for, do they have some kind of lesion in the brain that we can cut out? The problem is that if it is in a silent area of the brain, and by silent we mean areas that don't have major function, then we can't cut it out. But if your lesion is right there in your language area, you cut it out and then you cannot talk. So that's the problem with lesions in the brain. So you have to map it out, and then once you map it out, then you can decide, is this something I can cut out or not?
Interesting. So this would require then, and it's not something that a parent necessarily needs to be, or an individual needs to be concerned about. Would you say this is a relatively straightforward procedure, surgery, or is it less?
It depends. If it is, as I said, if it's in the silent area of the brain, like the temporal lobe, we do these all the time, temporal lobectomy. So this is a pretty more or less straight. It's still brain surgery, but it's a straightforward brain surgery. But if you have a lesion that is in some eloquent area like language or movement and stuff like that, then it becomes trickier. But this is not something that the parent of a child with no onset seizure needs to be thinking about, because most of the time we can control them with medications and we don't have to be talking about this.
I see. And then medications, and you can live a relatively normal life as long as
Correct. As long as your seizures are controlled, you go back to living a normal life. So we tell them usually for the first 3 months, that's by Texas law. If you're under the care of neurologists and on seizure medication, if you go 3 months seizure control, then you can go back to having no limitation, like go back to driving, for example, which is the biggest problem that older teenagers face.
And you know, I'm going to talk to you about a specific case. We're going to take a quick break, but a specific case that was just like that, a teenager who wanted to drive. We'll be right back after the break.
The Russ Martin Show.
What are the little fish that hang under sharks?
The ones you always see like in Shark
Week.
Week.
What are they called?
Pilot fish? Pilot fish, yes.
Why are they called pilot fish? It's not like they're driving the shark.
No.
What are you doing? I'm driving this shark.
The Russ Martin Show.
Not to be left out, there's Leprechaun in the Hood, which came out in 2000, which was...
Oh, man, he had to have a field day stealing gold teeth.
Tomorrow morning, 7 to 11. Talk Radio, 1190.
Ransomware is software that can infiltrate your business through email, enabling cyber criminals to hijack sensitive information as ransom for your own data's release. Leveraging Barracuda email security with advanced threat detection can stop a ransomware attack in its tracks. As an added measure, Barracuda Backup allows you to recover your data without having to surrender to extortion. Crime doesn't pay when you protect your business data with Barracuda. Go to barracuda.com/ransomware to learn more.
Mom was diagnosed with Alzheimer's at 58 years old. 8 years into the disease was when all the light went out.
For me, it was heart-wrenching.
Looking into the eyes of somebody with Alzheimer's, sometimes you just don't see the person's soul is like gone.
And it takes a toll on everyone. I mean, it's a depressing disease to watch unfold before your eyes.
She actually thought those of us who were caring for her and who loved her most were her worst enemies.
More and more responsibilities fell on my shoulders.
This disease just ravages a family.
It changes your life.
The magnitude of it is indescribable. My mother taught me to be in the moment.
We have to live in the moment with them.
And I'm going to be with that person right now in this moment, wherever she is.
Now is the moment to stop Alzheimer's disease. Call Bright Focus at 855-345-6237.
You're listening to the Therapy Hour with Rusty Lozano, brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas.
Hi, we're back. And if you're just joining us, we have Dr. Khourey, my friend CK from Texas Neurology, in Dallas, and we're discussing seizures and seizure activity. Before the break, we started to get into procedures, and one was surgery. And I wanted to talk about a specific case because we mentioned that teenagers want to feel normal and want to drive. I know a specific case where there was a patient that I was working with, and the family was just wonderful. And I won't say any names, but I can tell you what the case was. So he had seizure activity. We worked with each other quite a bit on using some biofeedback therapy to help him manage his stress. Because it seemed like in some instances when his stress level was high, that he would be susceptible to the symptoms of a seizure. But I remember there was a time that it kind of frightened me to hear what he was doing. But he used to race trucks. Like he used to get his truck, and like any teenager is going to want to show off their wheels, but he would do it dangerously. And one of the things I talked to him about quite a bit was the concern I had about how, perhaps, what if he had an episode while he was driving? It would essentially he'd become a dangerous projectile. Do you run across things like that?
We run across this all the time. Telling a teenager who just learned to drive that you need to stop driving is like the biggest blow to their ego, to their lifestyle, to everything. When all their friends are driving and all of a sudden it's like, come pick me up because I cannot take the car. And then all of a sudden they have to explain to everybody else, well, yes, I do have seizures, I'm having epilepsy. It's a big deal. So, but you've got to do what you've got to do. But I always tell them, forget about the fact that you're in the car and if you have a seizure, you can fall down the ravine or kill yourself. What if there are kids playing on the side of the street and you have a seizure and now you kill 3 or 4 kids just because you decide to drive even though you shouldn't be driving? How can you live with yourself beyond that? And that usually resonates with them better than you can die, because as a teenager, your sense of self is so big that death is never scary. And that's normal part of being an adolescent. That's normal part of brain development. Otherwise, they would never be able to break away from their parents.
You mean these kids that are jumping off houses on the picnic table? You mean they'll get hurt for doing that? So it reminds me of that show Jackass that they aired on MTV for a while, and that was the name of the show, folks. I'm sorry, but they would do these stunts to each other, and a lot of it was, it seemed just very extreme.
Yeah, I've seen it. It's totally extreme.
But you're right, though. Adolescents do go through this. It's like a what's the word I'm thinking about? I'm immortal.
Yep.
I'm an immortal.
Death is not scary because they don't think they can die.
Yeah, because there's not even any kind of point of reference to that.
Biologically, it's because the frontal lobe is not yet myelinated, so they don't have that sense of danger, that sense of knowing the consequences of what they're doing.
Yeah.
And evolutionarily, this is important because otherwise they would never break away from the home. So if the frontal lobe develops before they do all of this, then why would they leave home? What is more comfortable than having somebody pay you for your rent, for your food, doing your laundry? Why would you ever want to leave
live for free, right?
Yeah.
Those are great days. I'd like to get back to those.
Yeah, and the other thing that is that you see is that all the great artists, all the great sport people, it all develops during those years because you feel so invincible during that time that you're willing to take that extra step that as an adult you also start thinking like, hold on, that's dangerous, I don't want to do it.
Yeah.
And that's why this is actually from a societal perspective, it's also a plus, even though it's dangerous to the individual.
Yeah, and that actually falls in line with a lot of the theories, developmental theories, and how we think about the concrete and pre-operational states in the brain.
Correct.
And how children, up until they get to a certain age, they think very concretely, and the abstract ability, the abstract thinking, isn't actually ever available to them until they're much older. Have you ever seen in a circumstance with seizure activity where you didn't see frontal lobe development? It reminds me of halted frontal lobe development. There was a story that was about Phineas Cage.
Yes, that's not frontal lobe, that's temporal lobe, and that's because he had the surgery.
Okay.
And he lost his ability to develop new memories. So he was stuck in whatever year they did the surgery in 1947.
Yeah, and before he was, the brain's very complicated. Before he was very astute and he was a respected individual
in
the
the
community.
He was very astute. He didn't become stupid. He just was not able to form new memories. So anything that you would teach him, he cannot retain that information.
Yeah.
So he continued. He had all his old memories, and he continued living as if this is the year that he's living in. And he would not move year to year with the times.
Do you see those type of symptoms with epilepsy?
No, we never do surgery on both temporal lobes.
Well, no, I'm saying, do you see that type of symptom where an individual's memory is affected because of seizure activity?
Yes, definitely. If seizures affect the dominant temporal lobe, it can affect their ability to form memories sometimes. The brain window of moving things to the other side when one side is dysfunctional. So we don't see a Phineas Cage-like case anymore. It doesn't go that far. But yes, having short-term memory problem is actually not that uncommon.
I see.
Especially if they have a lot of recurrent seizures. Not that they had one or two seizures and now they're controlled.
Some of the symptoms of seizures, as outlined by the Mayo Clinic, is because epilepsy is caused by abnormal activity in the brain cells, seizures can affect any process your brain coordinates. Seizure signs and symptoms may include temporary confusion, a staring spell, uncontrollable jerking movements of the arms and legs, loss of consciousness or awareness, and psychic symptoms.
So what is a seizure? Let's go back to the basics. Seizure is an abnormal excessive firing in the brain. So the way you explain it to patients is that you have an electrical network, and all of a sudden you have a short circuit. So what will happen? You'll blow the fuse at home because you have a fuse in the brain. You don't have a fuse that you're going to blow out. So you constantly fire over and over, and you have an excessive activity of whatever that activity is. So if it's an area that's responsible for awareness, then all of a sudden your awareness is blocked. If it's an area that causes movement, then you have excessive jerking movement of that body part that is involved. If it's an area for sensation, then you have tingling in your arm, which would be a form of seizure. So whatever area of the brain happens to have that short circuit, you're going to have symptoms of that part of the brain. These we call partial seizures. And then if that abnormal electrical activity spreads to the rest of the brain, then it's a generalized seizure. Then you go into the full-blown flop to the ground and jerk in arms and legs like you would see on TV. That would be the full-blown seizure, or what we call generalized tonic-clonic seizure.
Tonic-clonic seizures, and that's definitely one of the types here.
That's when it spreads to the rest of the brain.
And that's when the hallmark movement and
correct.
Jerking.
That's the traditional, like Hollywood seizure kind of.
So, what is your experience with absence seizures?
So, absence seizure are part of what we call benign epilepsy. These are kind of epilepsies that kids develop during childhood, and they tend to outgrow. There are a few who would continue into adulthood, but the greatest majority will outgrow their absence, and it doesn't have major long-term consequences on the brain. Maybe a little bit higher rate of ADHDs in those kids, but really neurologically they're completely intact and they can go back to leading completely normal life. And it's a relatively easy seizure to control. So when they come in, they usually come in because the teachers notice that they're not paying attention.
Yes.
So they come in as maybe had ADHD most of the time. And then you evaluate them, you get the history, and it's like, well, it's atypical for ADHD. It sounds, let's get an EEG, and they have a hallmark signature on the EEG. So you get the EEG, you know exactly what it is. And we have very effective treatments for it, and we've had treatments for absence epilepsy for decades now.
And I think that, I'm thinking about a case that I worked with a child at Shelton School, and before they actually went and sought out medical consultation, this child would sit and we would count how long he could stay engaged, and then he would turn and look out the window, and it's like he would stay there, and I would ask the teacher not to disrupt him because I want to time it 11, 12, 15 minutes at a time, and then it would take the teacher going and making some sort of interaction with him to.
That's not absence.
Okay.
That's not absence at all, because absence seizures are typically less than 30 seconds.
Okay.
They're very, so it's literally, and then they're back with you. It's literally that. So they're talking, they have a brief pause in their speech as if they're thinking of the word, and then it comes back, and then they keep on going. So what happens though, when they have these multiple times a day, so when they're sitting through the classroom and they're having blank pauses throughout the lesson, by the end of the lesson, they didn't get much. Well, how does the teacher interpret that? That they have ADHD, they're not paying attention.
Right.
While in reality, their brain is just freezing temporarily, repeatedly for 30 seconds or less.
And they have zero real recognition that they're doing this.
They don't have any realization that they're doing this. The only time it's too brief for you to realize it. Yeah. If you're watching TV, you blink, you don't miss much.
Right.
It's very hard for them to realize they're having this. If they're having longer absence, maybe 30 seconds, they may, like if they're watching a very dramatic scene, when all of a sudden the scene is gone and they don't know what happened in the scene, they may notice that. But short of that, they really don't know that they're doing it.
And it's so fascinating. It's such a fascinating condition, and you know, I think it's saddening, but also it's interesting how the brain works. So there is zero auditory and visual input at that time. It's just like the brain just shuts off.
Correct. And the good thing is that in epilepsy, that's one of the good epilepsies to have. So if somebody comes and says, we're going to give epilepsy to your child, choose one, it's probably the one I would choose.
Yeah, because it's actually, I guess it's a little bit more on the milder compared to like the tonic-clonic you're talking about.
Treatable, and they outgrow it. There are other milestones also. It's not the only one, but it's of the common epilepsy, it's probably the mildest.
When would somebody see, how could somebody recognize this? Is it that they would actually have to know that looking at a child like a teacher and thinking,
the teacher usually cannot tell the difference if this is absence or if this is ADHD. So the teacher can tell is that he's not paying attention in class, take him to the doctor. And that's what happens usually.
Okay.
They come to us and then we do the evaluation and then we differentiate between the two.
Because it can also be misinterpreted as an attention deficit if you're not paying attention.
Correct. It's like the case that you just said, 15 minutes looking out. There are seizures that do that, not absence though. Mm-hmm. Or it could be just ADHD. The thing is that if it's a seizure, the teacher tapping you would have no consequence.
Okay. Zero effect.
Correct.
Yeah, because the brain is shut off. They wouldn't be able to interpret any of that. You ever seen it actually last more than 30 seconds?
Yeah, but not absence. There are other kinds of seizures.
Okay.
Or atypical absence can last longer.
Okay.
But there are staring spell seizures that last longer than 30 seconds.
Interesting. We're going to take a quick break. Hold that thought. We'll be right back.
Hello, Coach Gary inviting you to Sports Talk Sunday night 6 to 7. Join me with my new co-host, Warren Shore, the Whiz Kid. We'll do what we do best, talk sports. Join me, the Whiz Kid, and Ben every Sunday night 6 to 7 on 1190, the station that knows talk.
There are two things every parent wants when their child goes to college. For their child to do well and a way to afford it. Now, with Discover Student Loans, parents can have the best of both worlds. Not only do our loans cover up to 100% of school-certified costs with zero fees, but we'll give them a cash reward for each new student loan if they earn at least a 3.0 GPA or equivalent. That means every A in history or B in math could help them earn a cash reward for good grades. Just one of the many ways we treat you like you'd treat you. Apply now in 15 minutes or less at discoverstudentloans.com. Limitations apply.
It is officially vacation season, which usually means constantly worrying about whether your car is going to survive the road trip. Could put your mind at ease this summer with a new ride from D&M Auto Leasing. D&M is the only place you can get the exclusive Easy Lease. Call D&M today. Any local area code 35LEASE, 35LEASE, or go to their website. It's dmautoleasing.com. The call, that's free. Not calling, that could cost you thousands. And D&M is another proud supporter of the Russ Martin Show Listeners Foundation.
We make leasing easy at D&M.
In small towns and big cities around the world, Habitat for Humanity volunteers gather. Hammers are raised, bricks are laid, and another family finds shelter in a home they help build. Habitat volunteers are changing lives for the better, and in the process, maybe even their own as well. Support the work in your community or wherever your heart leads you. Volunteer, get involved, and help build it. Visit us at habitat.org.
You're listening to the Therapy Hour with Rusty Lozano, brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas.
And hello, we're back from the break. If you're just joining us, we have Dr. Khourey, CK from Texas Neurology, a good friend of mine we've worked with each other for a while, and he's moved from our children's house at Baylor, and we were just talking about this over the break. They actually shut down the facility. And they had great staff. They had a really neat setup there. And yeah, now he's moved and he's at Dallas. He's in Dallas at Texas Neurology. Great operation. Before we left, we started talking about the different types of seizures, and we had covered tonic-clonic seizures, and we had covered absent seizures. And so there are just a few more I wanted to discuss with you and see if we can maybe get some clarity, because they all manifest so differently. So with tonic-clonic, there's actually tonic and then there is clonic seizures. What are the differences between those two?
Tonic means you stiffen out. So there are seizures where you stiffen out. clonic means you're jerking. That's usually where you jerk. But the most common type is the one where you go stiff first and then you jerk. So it's tonic, then clonic. So it's called tonic clonic.
And those are the people that you would see, like maybe falling down from stairs and
then jerking.
So they freeze first.
They stiffen, and that's why they fall.
Is that why they when you see it portrayed sometimes, they put something in people's mouths so they don't bite their tongue, or?
So that's wrong.
Okay. I'm glad I'm saying this.
Yeah. That's the Hollywood thing where they worry about they're going to swallow their tongue or something, and they try to put, that's all Hollywood, and that's completely wrong.
You can't swallow your tongue?
Not only that, you should not put anything in their mouth because they either swallow that or it can break their teeth, or so because they're so stiff, they're biting down, that if you put something in their mouth, it actually increases their risk as opposed to helping them.
So if they're biting down on their tongue, then you shouldn't try to pry their mouth open to help them.
Not at all.
You just deal with the injury and leave it.
Yes, and the tongue heals very well.
And you can't swallow it.
So that's why frothing at the mouth is very common. Bleeding from the tongue is common when they have these big seizures, but that in itself is not the problem. So that heals, and that's not a big deal. But we do a lot of teaching with parents. Do not try to get into their mouth.
Oh, that's an important thing to identify. Is the frothing in the mouth coming because their airways are they're running through the saliva gland?
Correct.
A lot of saliva.
And not swallowing. We constantly are swallowing our saliva. If you stop swallowing your saliva, it's going to be coming out.
And then you're blowing air through it, and then it gets real frothy. So interesting. What about atonic seizures?
Atonic seizures are an interesting kind of seizures because they typically carry a worse prognosis. They're usually associated with some kind of developmental delay or something like this. And it's nothing more than you just lose tone. So it could be as severe as your whole body loses tone and you fall down, but you literally crumble as opposed to stiffen. Or it could be as little as a little bit of neck control. Some kids, all they do is that they lose neck control. And that's their seizure, and they do a whole lot of that.
And they have like the jerking movements. And
they don't jerk. Just they single loss of tone. So the head drops, and then it comes back.
Do all these require the same kind of medication? The same kind of treatments?
No, different medications work differently for different kind of seizures. So Absalt has something specific for it that doesn't work for anything else, for example. But it also responds to other drugs that other seizures. So the way we think of seizure medications, we think of those, there is one that works only for Absalt, ethosuximide. And then the others, we think of them as those who work only for partial kind of seizures and those who work for more generalized and partial seizures.
I see. I'm going to switch the topic here for a second, and kind of bring in some research that was done in my field with EEG biofeedback. Are you familiar with neurofeedback? So in the 1970s, Joel Lubar, I mentored under him for about 5 years, and in the 70s there were a group of these researchers that would do animal studies. I mean, it was all about animal studies and what they could do with these new electronics that they had, computers as big as the room. But he had actually trained cats to produce a certain rhythm in the brain called sensory motor rhythm. It's about medium beta. And so anytime that they would produce this medium beta, he would send a little jolt of electricity. He and Barry Sturman, anyways, they did the study, and they would send a little jolt of electricity into the pleasure center of the brain. And so then it taught these cats to produce these responses like, well, that's cool. Well, great, neato. And so here comes NASA, and this is a documented study. But a lot of their pilots were having seizures and having these very seizure-esque type of convulsions from being exposed to jet fuel exhaust. So NASA had heard that Sturman and Lubar were doing this study, and so they contacted them to say, well, we heard that you're doing these animal studies. We're wondering if you could actually come over here and study what's going on when these gentlemen are these pilots are being exposed to jet fuel exhaust. And so what happened is they took their cats, and then they also got, they brought in several other cats, and they exposed them to the jet fuel exhaust, and they all started to have the convulsions and having all of the movements that seemed like they were seizures, except the cats from that previous study where they actually trained sensory motor rhythm. from the cats that actually train high beta, medium beta. So it's a very controversial study because what it was actually indicating is that, did they find some approach that was effective for epilepsy? What is your opinion on something like that?
I'm not familiar with the study, but based on what we know already, that if you're starting to have a seizure and you're able to cause an electrical activity adjacent to where the seizure is, you can sometimes stop the spread of the seizure and you abort the seizure. So the real-life experience with that is people with, for example, sensory seizures. They start having the tingling, and if untreated, that's going to spread over the brain, and they go into the full-blown tonic-clonic seizure. And those, it's rare, but those people who have that, we found through the patient experience and then corroboration through medical studies and stuff like that, that, for example, let's say it's starting in the head. If they cause like a severe pinch that is causes pain, it discharges that area of the brain just next to where the seizure is, and it stops the seizure from spreading because you've caused electrical activity in that part of the brain. So it sounds like potentially, I don't know, I didn't look into the specifics of it, by causing this rhythm activity in the motor area, stopping the spread of the seizure, so they're not going into full-blown seizure potentially.
Yeah, so they gave this presentation on it, and they were actually disclosing all of their stats and the studies on it, but they were showing how training the sensory motor rhythm, medium beta with neurofeedback, how they firewalled, so they trained all around the affected area so that it couldn't spread.
Correct. That's based on the sensory study that I'm familiar with. That's what it sounds like.
Interesting.
It kind of makes sense.
Yeah, it makes sense. Highly controversial, but it's something that I know that it was out there, and I just wanted to ask your opinion on it.
Mm-hmm.
Did we cover all the seizures? Was it myoclonic? Was that the last one that we spoke about? Or?
We did. We talked about atonic.
Oh, okay, myoclonic.
There's tons of types of seizures. As you said earlier, it's whatever the brain function is. But when we think of seizures, if you want to think of that, go with the seizures in general, we think of sensory seizures. You have the tingling, the numbness that spreads, like basically when your arm goes numb, and like you have hands in your arm. That's the seizure. You have the motor seizures, where you're either jerking, so it's a clonic, or stiffen, it's tonic, or you lose tone, it's atonic. And then you have the seizures that don't have a sensory motor expression, and these are the staring off in space. Absence is one of them, but complex partial seizures from the temporal lobe can present just like that. And then you mentioned earlier, the psychic seizures.
Mm-hmm.
So some seizures, all they do, for example, is an intense sense of fear, or if it's an overwhelming sense of fear for no reason, and that's your seizure. So if it's coming in the area of the brain that is responsible for emotions, then you're going to have an emotional response as your seizure.
Interesting, because that area of the brain is the one that's actually stimulated.
Correct.
So what do those emotional responses manifest? How do they manifest?
Fear is the most common. So you have an overwhelming sense of fear, but anger can also happen. We get this gets very controversial because it happens that we get called to court. Personally, I've never had that happen to me, but I've had colleagues who've been called to court because somebody killed his wife, and he's claiming that's part of his seizure. So how do you know? Is it truly because I had no control? It's just my seizure that I killed somebody, or whether I truly am a murderer and I killed somebody? With seizures, anger cannot be directed. So if I'm having my seizure, and anger is part of my seizure, and you happen to be in my way, then you can get harmed, and that's part of the seizure. If I go to the kitchen, grab the knife, go back to the bedroom, and stab my wife, that cannot be part of my seizure. That's too coordinated, too planned for it to be seizure. Seizure, you have no
You're talking about like a primal kind of anger, and like a gorilla.
Correct.
I mean, you would just react very, very like in a primordial fight or flight.
Correct.
Wow. Have you seen those kind of cases? Have you heard of those? That somebody has claimed?
I've had colleagues who had to go to court.
I wonder how often they're actually able to, to find that was actually the case. It was a result of it.
It really doesn't depend on the neurologist. It depends on the investigator telling us how things happen. And then we can say, no, it doesn't make sense. This cannot be seizure, or yes, it makes sense. This could be seizure.
Yeah, and I'm sure that there's extensive testing that they do to confirm that that's
Yes, first we need to confirm that they have seizures.
Right. You can't just claim that. Right. It's like, hey, this is what's going on with me.
Yeah.
Yeah.
So first you confirm they do have seizures, but if you do confirm they have seizures, because they usually call you a treating neurologist, so you know that they have seizures, then the question is, how did the crime happen? This is extremely rare. I don't know.
Yeah, I know. It almost seems like it's fascinating.
Yeah,
isn't it?
It's fascinating, but
it seems like it'd be a Law and Order episode or something.
Exactly.
I mean, it's something that you just really don't hear about at all. But wow, how could that actually fly? Interesting. So with all these different types of seizures, there's medicine approach. There's the medical management, and we're going to talk maybe, and we're coming up on a break, but I want to kind of see, well, what other types of treatments. But I do want to talk to you when we come back from the break in a bit about pseudo seizures and like the presence of them. I actually have had patients that one in particular that came in. The mom didn't know what to do. She was perplexed. This was before she sought out medical consult. But I'm trying to teach relaxation skills to the child. Very distressed.
So pseudo seizures are definitely up your alley, and we can discuss that.
Yeah.
Because I would send my pseudo seizure patients to you.
Yeah, because it was really interesting how it was happening. Because it looked like the tonic-clonic seizures that you were discussing.
Correct.
And I'm really excited to talk to you about this because when I was seeing it, you could tell that it was something very uncontrollable, and you couldn't really incoherent to something. So we'll be right back. We're going to take a quick break.
Local music in North Texas has a voice, and you can hear it Saturday nights on the local lounge. Join me, your host, Zach Killian, as I bring in musicians, directors, and local talent as they discuss humble beginnings, rock star moments, and how to make it in today's local music scene. It's the Local Lounge. Saturday nights from 7 to 7:30, only on Talk Radio 1190.
Not available in all states.
Hey, Carl, how is it you're always golfing? I thought you owned a business.
I own a Reese and Irvy's robot franchise, Bob. The robots serve 7 flavors of delicious frozen yogurt, and the franchisor secured the best locations for me.
Sounds so easy.
Yep, easiest employees you'll ever have. Where are you going?
To learn more about a Reese and Irvy's franchise opportunity.
To learn more, go now to froyofranchising.com and use promo code 3535. That's froyofranchising.com, promo code 3535.
If you're over 50, listen carefully. Do you have trouble remembering names, where you put your keys, or where you parked your car? Even simple facts that you should remember but just can't? By age 50, the average person has lost half of their short-term memory, and it only gets worse. Don't ignore the warning signs of age-related memory loss. Call now to receive a free 30-day supply of Cebria, the best-selling non-prescription memory formula supported by 20 years of memory research. A scientific study shows that Cebria can boost your memory within just 30 days. Just call 1-800-990-7765 to get started.
I saw myself go from forgetting people's names, forgetting phone numbers, forgetting you name it, I don't know, to having it all at my fingertips.
Get your free bottle of Cebria, 1-800-990-7765, or order online at freememoryoffer.com. 1 free month per household. Don't wait. Call 1-800-990-7765 or go to freememoryoffer.com.
Right now, there's a girl in India who has dreams bigger than her village. Right now, there's an elder in Guatemala who dreams of a life of greater dignity and less loneliness. You can help change the future of one person in a single moment. Begin the change at unbound.org.
You're listening to the Therapy Hour with Rusty Lozano, brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas.
Hello, we're back from the break. And if you're just joining us, we're having a really fascinating conversation about epilepsy. And we've gone over the different types. We've talked about some of the reasons and causes and risk factors. But there's one that I really want to get into. I was really looking forward to talking about this in particular. Pseudo seizures.
So let me stop you right there. We try to not use the word pseudo seizure anymore, because pseudo means fake,
Oh.
And many of these kids are not actually voluntarily faking.
Well, I'm going to update my terminologies then.
So it carries a negative connotation. So we call them non-epileptic seizures.
Okay.
They're seizures, they're attacks of abnormal brain activity, right? We define seizure as abnormal brain activity. And they are having abnormal brain activity, but it's not due to epilepsy.
Got it.
So we call them non-epileptic seizures.
I'm glad you corrected me on that because I don't want to.
Yeah, because in the past we used to think, they're faking it, so they call them pseudo seizures.
Right.
But we now know that this could be a presentation of their panic attack. So their panic attack can be that seizure. Panic attack is not faking.
Yeah.
You cannot stop a panic attack because you say, okay, I'm going to stop my panic attack, unless they work with somebody like you to train them on how to stop the panic attack.
Right.
So somebody like you can train them to stop their pseudo seizures. But normally, it's not like me moving my arm. Okay, stop moving your arm. So that's why we try not to call them pseudo seizures.
So I'm thinking about the case that came in, and I started to talk about this before the break. But it was a young man, and he was a Jesuit, and I won't say any names, so I can talk about this openly. But he really did present. I mean, his breathing was really rapid.
Mm-hmm.
His eyes rolled back behind his head, and his muscles were trembling, and it seemed very seizure-esque. And I don't know, maybe that could have actually been a real seizure.
It is a seizure, and that's what I'm trying to say.
Okay.
All of them, we call them seizures.
Okay.
The question is it an epileptic seizure due to epilepsy or not due to epilepsy?
Non-epilepsy.
So we call them all seizures. I always tell my patients, this is a seizure, but your seizure is not due to epilepsy. So giving you epilepsy drugs won't help. Your seizure is due to your underlying anxiety, and this is the presentation of your panic attack. And that's why using anxiety medications is what helps. So a panic attack can present in various ways. It can present in the typical, I'm scared and I'm fearful, I'm acting in a fearful way, but it can also present with neurologic symptoms. So it can present as a seizure. It can present as stroke. Because you have so much anxiety, that part of the brain shuts down.
It's like it's shutting down. It's negating. It's on so much. There's so much of an overdrive that it goes back to that Descartes, concept of negation.
So it's an abnormal brain activity. When it's so overwhelming, it can present as excessive brain activity and it present as a seizure, or it can be so overwhelming that part of the brain just shuts down and present as a stroke. So anxiety can present in very various ways. Yeah. And it's important to differentiate the two because one is treated with seizure meds, the other one is treated with anxiety meds and biofeedback.
Right. Yeah. And the peripheral biofeedback is what we're discussing, and that's the relaxation type. And I will say that there was another case of an individual that had the non-epileptic type, and she was her body moved in such a way, and her breathing was off. She ripped up my leather couch, with her feet, and she was just thrashing her body like she couldn't stop. So rationally, she wouldn't, it's not something that somebody would do, and knowing that they're destroying somebody's property. But in this case, it's like something she couldn't help.
And remember, in psychiatry, you have the factitious disorder and the malingering disorder. Is there somebody who would fake seizures because they want to get out? Maybe they exist, but usually that's the minority of cases. And that's where the psychiatrist's job comes in, not me, to try to differentiate is this through malingering, where they're conscious of they're doing and they're doing it on purpose because they're trying to get mom's attention, or is this through anxiety disorder where they have no control over it?
And that's how it's actually and it's manifesting in this way.
Correct.
Are you seeing a lot more of these days? Do you hear about the non-epileptic seizures? Are you getting many of these?
We've always gotten many of those, but I don't see in my practice. I haven't noticed that all of a sudden now we're getting more of that.
Yeah, well, I was curious if there's a correlation between how difficult school is these days with how well these kids can manage.
We do see way more headaches because of the stress.
Right. Yeah, and that's well, there's always going to be headaches where there's stress. There's going to be
when there's stress, there's pain.
Yeah, school is not what it used to be. It's great though because now you have these 10-year-olds that are developing these contraptions. You hear about the little 10-year-old that developed the in-car air conditioner and alerts the police.
Correct.
So I think we're evolving, in a certain sense that, the intelligence is starting to kind of shift. But
the stress level is also increasing, exactly. Everything comes at a price.
Yeah. So going back to the concept of how the complications can affect people, we talked about falling. We talked about drowning, car accidents. I did just want to mention just one thing. What about pregnancy complications? What if somebody is pregnant and they have seizures?
So there is a higher risk of miscarriages in women with epilepsy, just because of the seizures themselves. So then the discussion becomes, do I put you on seizure meds, even though we know they could affect the baby, and take that risk? Or do we not put you on seizure meds, but you have seizures, and take that risk of the baby dying, right? Because of lack of oxygen supply, lack of blood supply, because of what's happening, or if you're falling and you're hitting yourself and stuff like that. So there's always this balance. So the recommendation currently is that if you are on seizure medication for your seizures, you stay on your seizure medications for your seizures. And then we monitor your levels because your blood volume changes, so your levels may change. So make sure you don't have breakthrough seizures. There are a couple of seizure meds that if you are on them, we have to take you off because the risk of fetal abnormalities is much higher with those, like Depakote. So if you're on Depakote, we're taking you off Depakote. If you're on other stuff, if you're controlled, taking you off to decrease the risk of that drug puts you at a higher risk because of the risk of the seizure, because I don't know what else is going to control you. I know you're controlled now. So it's much safer to stay on your drug. Right. And then there is a national registry for any woman who gets pregnant to keep track of the outcomes of the pregnancy for the individual drugs that we know long-term, which drugs seem to be safer.
Is the risk in pregnancy because of the contractions, or is it just maybe all of the above?
It's all of the above.
You can have a car accident, you can drown, you can fall.
No, you're at home and you fall on the ground and you're bumping around. That's not good for the baby.
Yeah, that would actually be terrible.
Correct. But it's also the seizure itself with how the contractions happen that can be detrimental to the baby. So we always recommend that you stay on seizure medication, but you have to take folate supplementation to lower that risk of fetal complications. So higher doses than the normal neonatal vitamin. Prenatal vitamin.
Yeah. So
always talk. So if you're an epileptic woman, do not, if you're planning to get pregnant, plan it with your doctor, basically.
Yeah.
That would be my recommendation.
I went to school with a young girl. Her name is Rebecca Khourey, and I've known her since we were in first grade when we met, kindergarten, first grade, we became friends. And then over the course of, you follow the track, middle school, high school. As you kind of keep touch with people, you hear about what's going on in their life. Well, she passed away, 4 or 5 years ago. And I was trying, because I haven't heard from her in a while, and I wanted to find out why. And somebody had mentioned it was because of her epilepsy. So I'm seeing a sudden unexplained death in epilepsy, or SUDEP.
Mm-hmm.
Can you explain that a little bit to me?
I wish.
It's perplexing.
We don't understand that very well. There is a higher risk of sudden death in epilepsy. It's not huge, but it does occur. And we don't understand fully why it happens or how to prevent it. Because if we understood it, we would be able to prevent it, and we don't really have a good understanding of it.
Yeah, because, she wasn't involved in an accident. It wasn't something
with nothing else.
It was she was just laying in her bed.
Correct. There's a higher risk of sudden death in epilepsy.
Interesting. Even when you're medicated?
Even when you're medicated.
And it says the research shows that it may occur due to heart or respiratory conditions, but the cause is definitely unknown.
Correct. But it's possible. It's a theory. We don't know. Nobody is being monitored until they die, right? So it's hard to say, hey, come here, I'm going to connect you to an EEG the rest of your life until you die. But the thought is that abnormal firing in the brain, because the brain controls everything in the body, including heart rate, can, for whatever reason, in some patients, sometimes lead to an abnormal heart rhythm, and that's the potential cause.
That's the potential cause, is that you may have a heart attack.
Yeah, cardiac arrest.
Yeah, cardiac arrest. So
it's a theory, right?
It's a theory. And it says overall, if you do have epilepsy, it's not something you have to be concerned about, is because it says overall only 1% of people with epilepsy ever die from
correct. As I said, it's a low risk, and there is nothing we can do about it. So to live your life worrying about that 1%, you would never ride any car. This is a 1% risk of getting in a car wreck when you get in your car.
Right. And you shouldn't let it affect the quality of life, because
we do tons of stuff that carry more than 1% risk of hurting or killing us.
Like what? Going to the grocery
somebody can come in and shoot up. So
yeah, right.
This risk is part of life. So when you say it's a 1% risk of suicide,
it's very low.
Exactly.
I mean, there are a lot of other things that can happen.
Correct.
So it's not that you want to start taking away the quality of life and living differently. Seek out medical help. Seek out consultation and medication. And
it's for a few months until we get you under control. Yes, you're going to have to make some lifestyle adjustments. But if we get you under control, then we'll go back to having a normal life.
Absolutely. And that's something that I think you need to be, and people need to be open to.
Correct.
At what age, this manifests at all stages of life.
Correct.
Even adulthood. So
it's a U-shaped curve. It's infants, then tapers down a little bit in adulthood, and then goes back up in elderly because of all the strokes and brain tumors. So in infants, it's because of the trauma of birth, also because of all the genetics, and then in the elderly because of all the trauma to the brain that happens from stroke and infections.
What's the soonest that somebody can get treatment for epilepsy?
Ideally, as soon as you have your first seizure, you should take medical attention.
So you can be as young as 6 months old.
We see infants with seizures, right? I consult in the NICU, and we have kids in the NICU with seizures. If you have brain damage, you're going to have seizures. No, I take it back. If you have brain damage, you are at risk for developing seizures.
Got it.
It's not you with developing seizures.
Well, CK, I want to thank you so much for being on the show. Learned a ton about this, and I always do every time you come in. And learn not to use.
It's always fun.
Yeah, and I learned not to use pseudo seizures. Well, thank you very much for listening, folks. I hope you have a great weekend, and we'll see you next week.